Okie doke. Hello, everybody. Welcome to Friday. I'm Colleen Parent. I'm pretty sure, hopefully, almost all of you know who I am. I'm the medical director at New Choices. I've been here for almost 2 years now in January, which is kind of crazy. So today we're talking about it's very basic first aid and infection control. Did the same thing last year, so you will recognize it. I didn't change a whole lot because they were pretty. Oh, okay, that's cool. There we go. They were pretty slides last year, so no big changes. But anyway, so basic first aid, it's kind of like what you think about, like, oh, what do we have in our first aid kit? We got some Band-Aids, some tape, some gauze. Basically, if you have a first aid issue, go to Nikita's office. But there's also a first aid box up at the front desk in 728, and I think at CCS in the front end there as well, and in Jackie's office at CCS. So basically, we're just talking about recognizing the benefits of learning some basic first aid. It's all about keeping everybody safe, ourselves, our clients, people who are in our building who aren't our clients, assisting when needed, and to know what to do and recognizing an emergency. You don't have to know what to do for the emergency, but to be able to recognize an emergency and know how to dial 911 is important. So some basic rules. So staying calm is really important if there's an emergency. If people are sort of in a tizzy, that doesn't help things. So staying calm if 911 needs to be called. It's actually really important to say specifically, like, you call 911, because if everyone thinks everyone else is doing it, then no one is doing it. Keeping safe access to the person that's in need, performing current first aid guidelines, and to do things in a methodical, step-by-step sort of manner and not spazzy. So it's all about safety. It's sort of like, I feel like that's my job at New Choices, is all about safety. So keeping everybody safe. So before you just dive in and try to help someone, which we all want to help people, that's why we do what we do, you want to make sure that it's safe to do the helping, because you don't want to have then 2 injured people when there's 1 injured person already. So you want to make sure that, is there a fire happening? So if there is, you don't jump into the flames. Is there equipment that's unstable, electrical things, electrical hazards in water, being near each other, chemical hazards? We don't really have much in the way of chemicals in the building. There's cleaning supplies, and that's probably about it. And they're in the storage units for those types of things. So we don't have too much in the way of danger for that. So there's, of course, all sorts of different types of emergencies. So some people get injured. So people could slip and fall down the stairs. I guess someone could injure someone else. So people could break their arm, burn themselves, get a cut. There's, more serious type medical emergencies. Someone could have a heart attack or a stroke or overdose. And, we work with people, and people can have these things at any sorts of times. So it's just to be aware. Again, you don't have to know how to fix it, but to be like, something isn't going on right here. So heart attack signs and symptoms. Hopefully people will not be having heart attacks at New Choices, but again, anything's fair game anywhere. So some signs and symptoms of that. So jaw pain, shoulder pain, left pain going down your left arm, feeling tired, feeling short of breath, like walking up the stairs, man, can't really breathe, having chest pain or discomfort, nausea, and feeling lightheaded. Notoriously, women don't have the typical oh, my chest hurts and I can't breathe symptoms. It's varied, but if people are describing these things to you oh, I just don't really feel well, obviously you can bring them to our medical end. We have an EKG machine in our building. But if we're worried that something's happening, we're not going to wait for us to do these things. We're going to call 911, because we don't have all the equipment to here's some aspirin, here's some, we just don't have the stuff. So if someone's having a heart attack, getting them to the hospital ASAP is good. And if you don't know what's going on and they're having serious signs of just, they're not doing well, they can't breathe, and they're having chest pain, then to the hospital they go. So signs of opioid overdose, I'm pretty sure we're pretty aware of those things. Pinpoint pupils, being unconscious, slow, shallow breathing or not breathing, pale skin, lips turning blue, raspy breathing. But we do want to think about if someone we're scared that they're having an opioid overdose. Obviously, we have Narcan. There's Narcan available. I don't know why I'm pointing here. It's not in my, well, it is in my house, but the one at work is up at 728 is in the front between the bathrooms, above the water fountain. There's Narcan. There's a Narcan kit there. There's a Narcan kit between behind the girls in the front desk. We have it in our medical offices. But anyone can grab that. So it's readily available. I assume it's also in CCS. I mean, I just don't know exactly where it's located for emergencies. But that way, but it's more than just like get the Narcan. We want to make sure people are breathing. We have oxygen, we have airways, we have ambu bags to help people with breathing because most overdoses are likely a polysubstance overdose. So more than one substance being involved in Narcan really only affects opiates and is very short acting. So if someone is having an overdose, obviously we call 911 and we do the things that we can do to help keep their brain being perfused with oxygen. So I probably just went over most of this. So call 911. Oh, we have an AED in both buildings at CCS and 728. The AED at CCS is located in the waiting room area, and at 728, it's right outside the lunchroom. So what an AED is, automatic external defibrillator. So essentially if someone's like on the ground and you're like, holy crap, what's going on? And you're like, are they breathing? Do they have a heartbeat? And you're worried that they would need CPR or something like that. You can grab the AED. It has pads on it. It shows you where to put the pads. And then you just like press the button and step away because the machine figures it all out. So it's really, really great. You don't have to know really anything other than where it is and put the pads on. So that way it tells you, is there a shockable rhythm or not a shockable rhythm? And if there is one, it'll shock the person. So I think it's great that we have these available to us. If someone is certified in CPR, so that would be me and Stacy and Fiona and whoever else is, there's probably other people in the building. Then we can do CPR if that's needed. And then obviously someone should stay with the person until, 911 people arrive. But we don't need to like crowd people. So overdose, obviously we went over that too. And basically we want to help people breathe. That's the goal, is get people breathing. So this is just another little thing about signs for an overdose that shows what Narcan looks like. And if you want to administer it, wait on one side, wait a minute, see what happens, and then you can do the other side. Get people on their side in case they like vomit. But really we just want to get them to the hospital, get them with oxygen, all that stuff. That's what the AED looks like. So see how it shows where the little pads go. They're already connected to the thing. And then there's the power button. And then basically it's like stand back. And then it tells you to not touch anything. And it figures out if anything can be done with the person. If someone is talking to you, you don't need the AED. They have a pulse and they're breathing if they're speaking to you. So minor burns, hopefully there's not a lot of fire going on at New Choices, but people smoke, people do other things with lighters and whatnot. So hopefully there won't be a lot of burns, but you want to make sure there isn't anything around the area of the burn. You want to not have things stuck to it. Hopefully keep it in cool running water for like 20 minutes. You don't want to put ice on it. Ice actually will injure the tissue worse. And we have some dressing change stuff in our office, so you can keep it dry, cover it with a sterile gauze. And if it's severe, if there's a lot, or there's, the person is worried and it's not just like, oh, I burned my finger on the stove in the kitchen. Then obviously calling 911 and being transported to the hospital to have it managed. Someone could potentially break themselves. So winter is coming, unfortunately. So ice, snow, all that stuff. We try to, make it as safe as possible outside. But if there's someone could slip and fall. And if there's a severe fracture, so like if someone's bones are protruding outside of their body, they definitely need to go to the hospital because that's a compound fracture. That's very bad. Plus they'll be in a whole lot of pain. And if it's not that, you can immobilize the body part, the arm, the leg, the whatever it is. And then last year on here, I said to go to Ortho New York Urgent Care. So Ortho New York Urgent Care is no longer open in Schenectady. They just do urgent care up in Clifton Park, and that might be it. In Albany, Everett Road. So Clifton Park, that's right. Clifton Park and Everett Road. So it's no longer available in Schenectady. So if there's a concern, then they just need to go to the ER where they can get an x-ray and get a cast or get whatever is needed if something's broken, a boot. And then, so infection control. So last year I don't remember if we were still wearing masks last year when I did this thing. Obviously we're not wearing masks now. However, infection control is all of our responsibility, that we all need to sort of be mindful of not just sort of spreading our junk around. Hand washing is really important. So if you're touching other people, if you're touching food, if you're touching doorknobs, things are gross and dirty. So washing your hands is really important. And we can actually take care of a lot of germs just by washing our hands, which is a really simple thing to do. And apparently, according to this from histopathologyindia.net, 1 in 5 people don't wash their hands after using the restroom. So ew. So if you go to the bathroom, wash your hands, because we don't want to be touching you after that, right? Ew. Smartphones are filthy, like really filthy. And apparently women wash our hands more than men. So try to catch up, boys. So 5 steps for preventing or for infection prevention and control. So wash your hands, especially anytime they're soiled, bathroom, food, whatever. Stay home when you're sick with a fever. So last year, the whole COVID rules and illness rules. So pretty much if you're vomiting and if you're having a fever, you should stay home. So pretend you're like a kid in school, and we can't send our kids to school when they have fevers or they're puking. It's just not good. We don't want to spread that around. So same with us. So if you have a fever and are vomiting, please stay home. Contact your boss, your leader of your people, and let them know. A lot of times you can work from home if you have a laptop or whatever and can see, and you're not so ill that you're like literally your head's in the toilet all day. But if it's like regular sort of cold symptoms, you can check for COVID. But basically, I would highly recommend wearing a mask, even if it's not COVID. But if you've got like a lot of snot and you're coughing and respiratory, it's not a mandatory rule if it's not COVID. But I think just given the climate and atmosphere of things, that just wearing a mask when you're sick around people is just not a terrible thing to do. Getting vaccinated, flu vaccines, COVID vaccines, whatever vaccines are appropriate for you, your age, and whatever health conditions you have is great. And then universal precautions, which is like essentially assume the person in front of you has some infectious disease and you want to like wear gloves if you're dealing with bodily fluids. So you don't have to wear gloves to touch people, but urine drug screens, wearing gloves, urine oral drug screens, wearing gloves if you're taking things out of people's mouths. Obviously, when the gals are drawing blood, they're wearing gloves because we're going to assume the person sitting in front of us could have HIV or hepatitis C or whatever, anything else that could be spread to us. So most folks at New Choices are not dealing with blood, but if someone has a cut, if someone you're around, just assume that they could have something that you don't want to have. And so how to protect yourself doing that. And that's with universal precautions. And I think that's it because it's pretty quick. So happy to take any questions, or if I went too fast, or if you have any concerns or whatever, happy to hear.
I have a sort of question comment.
Sure.
I got an article earlier this week from actually out of Michigan about a nasal spray called OpV, which is like a stronger version of Narcan. It's a different chemical, but does the same thing as Narcan, but more effective on fentanyl. Have we seen or heard of that here in New York yet?
It's a prescription, so the FDA approved it, I think, in 2022. I don't know how much it costs,
Okay,
and it's called nalmefene, and it's supposedly longer acting. I don't know what that time period is. Like, is it a minute? Is it 30 seconds? Is it 5 hours?
right. I'll
And I don't know the answer to that. So my very cynical mind and drug companies is just like,
Yeah,
well, great way to make money. Um, but no, I haven't seen it, and we get all of our Narcan through New York State, so we don't pay for it, which is great, and we hand it out like hotcakes. But I assume once it becomes either, if it's shown to be significantly improved over Narcan, I'm sure that would be something that like they could use the
yeah, the state will.
settlement funds for. But if you have it, like if someone's prescribed it and you have it, like it's not like, oh, should I use my Narcan or should like just use what you've got. And we know everything is fentanyl. So it can take, that is one thing with opioid overdose. It can take, like, say you give someone Narcan, they wake up, but then a few minutes later or 30 minutes later, they might start nodding out again because that um, Narcan has worn off, and then it's possible to need. That's why we always call the ambulance, right? Because then they can go to the ER and be monitored. Obviously, not everyone consents to go, but when people are at home or they have friends and they're narcanning their people on that they know, they may not be calling the ambulance for whatever. So it is good to be aware that, like, hey, this does not mean it's one and done. It could mean that the fentanyl sticks around and you may need more Narcan.
One thing that maybe we could touch on is after we have somebody that maybe, let's say we have to Narcan, what is the proper procedure after we actually administer the Narcan? So in regard to incident reports and things like that.
Sure. So anytime there's like a medical incident, or if someone needs to go to the hospital, an incident report should be filled out. That's on the share drive. You guys might keep it other places, but I find it on the share drive, I think under forms, like the OTP, or not OTP, sorry, public forms incident report. And that way it just, and it's good to do it when right after it happens, so all the details are fresh in your mind and the people involved are put on. And then if someone's sent to the hospital, then it's important to get sort of follow-up records if we can, just to know what happened to someone, so they can, so we can just keep track of that as well. But that's same if someone like slips and falls and breaks their leg, like that will need an incident report as well. Basically, we want to make sure that we're being safe, and if changes can be made to keep people safer, then we can learn from those experiences.
And I'm sorry, I have one more question. Let's say there's a medical emergency. Do you need to be notified for every single medical emergency, or what does that look like?
So let me see if I can, let me stop sharing and then I'll search. So there, we had come up with like a protocol, um, of like, do this, do this. Do I need to know about every medical emergency? I think it's probably good for the medical team to be notified of something going on that needs medical care, just so we might have a, we might do things differently. Or, I mean, we don't need to be notified before you call 911. If someone obviously needs to go to the hospital, please, please call them. That doesn't need to wait for us. If we can be of service while that's waiting, like we're happy to. Like we got our pulse ox and our blood pressure cuffs, and again, we've got oxygen and ambu bags and things like that, so we can be helpful. I'm not helpful in terms of if someone's having appendicitis and they're having severe abdominal pain, there's not a whole lot I can do. But I'll find the thing and send it out again after we're done. I'll just email it out to everybody just so you can see sort of what, you know there's no harm in getting us. We're always happy to help. Someone is there between, so my hours are 8 to 5 Monday through Thursday. Stacy's there Monday through Friday 8 to 4. Fiona's there on Tuesdays and Thursdays, I think, till about 6. So there's people there all day. There are, like, we're not there till 8. So when the clinics open later till 8, we're not there. And Jackie is at CCS on Tuesdays and Thursdays and is available. And then there's nursing staff down in the OTP Monday through Saturday, 6 to 12. So if there's something going on, they can always assist as well.
Now, what if somebody is hurt or is needing to be Narcaned and is very adamant that they don't want 911 contacted, or they don't want to go to the hospital? What are your
So I'm going to
thoughts?
call 911 anyway. They can then deal with the paramedics, whether they go to the hospital or not, but the paramedics can throw monitors on them. They have other things that they can do pre-hospital that we can't. We just don't have the stuff. But I'm always going to call 911. They can choose to not go to the hospital, but they're going to be evaluated by the paramedics.
Thank you. Those are just some things that have come up over the last few months, so I figured we could open that dialogue.
I'm always going to encourage people to go to the hospital, again, especially if we don't know what it is that they've used, and people who are using and overdosing don't always know what they've used. Because our drug supply is so messy, and xylazine is there and fentanyl is there. And again, all of these are, for the most part, polysubstance overdoses. And just because Narcan might not help all the way because it doesn't reverse xylazine and it doesn't reverse benzos, it doesn't reverse alcohol, it only reverses opioids. So, and it might not be an overdose like we think it is because of where we are, but maybe they're having a heart attack because of something else, or maybe they're having, an arrhythmia, or maybe we just can't tell everything where we are. So I'm always going to encourage people to be evaluated because I don't want anyone to be harmed, and I want people to be able to get the help that they need. But obviously they get to decide. They can choose to not go to the hospital, but they're still going to be, paramedics should be called.
So, Dr. Parent, in regards to that, let's say that somebody doesn't want to go to the hospital and paramedics have been called and all that. Do we put that in, knowing that we have to write an incident report? Do we put that also into the incident report? Participant refused to go to, because of,
Yes.
even though okay.
Yep. Whatever happens should be in the incident report. So if, paramedics were called, they evaluated the patient or the client has refused to go to the hospital. Essentially, like for me, so if I'm doing that, I'm going to discuss with them. It's like leaving AMA almost, right? If you're in the hospital and you leave against medical advice. So them not going to the ER is basically going against medical advice. So I would document something like, patient was notified that by refusing to go to the hospital, they could potentially die, the potential negative outcomes of not going to the hospital. So they're aware of that. I know it sounds a lot of like cover your ass sort of stuff, but partly we need to do that. And it's also true, like they could die.
Right. Yeah. I know it, with working in residential in the past, you need to do that. But as far as where we're at 728, as far as that's concerned,
I would always document whatever it is that happens.
Yeah.
If the patient goes, hurrah, and you document that and what hospital they went to. And if the patient doesn't go, and you document that. But yeah, whatever, if it's not documented, then it didn't happen, kind of thing.
Right. Okay.
Always writing down what's true and what happened is always the best course of action.
Right. Okay.
Anyone else? Or while you have me, any other questions about anything, since I'm not usually on these trainings because I don't work on Fridays afternoons?
Is there any difference in our response if we believe somebody is maybe under the influence of alcohol and a narcotic or an opioid, excuse me? Or would we respond? Are we basically allowed to Narcan somebody if we know that they're actively drinking?
Oh yeah, Narcan only affects opioids. So if you Narcan someone who is not overdosing on opioids, it does nothing. So it won't harm the person if they're not having an opioid overdose. So, you know, it's when we look about like risk versus benefit, the potential benefit if they are using opioids and alcohol together of using Narcan greatly outweighs the potential risk because there really isn't any risk to Narcaning someone. Like I could take Narcan right now, it won't do anything to me. And so we're protected, and there's like Good Samaritan laws, right? So like you're protected to try to help someone in the best way that you can. You just don't want to forget about airway breathing and circulation, which is sometimes like the focus is so much on Narcan, 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 Narcan. We forget about like, oh wait, they need oxygen or they need chest compressions. Although chest compressions aren't part of CPR anymore, but or sorry, rescue breathing isn't part of CPR anymore, but chest compressions are. But we have ambu bags, we have oxygen in our office. So we just don't want to forget about those things. So Narcan is important, but it's not the only thing. And it's totally fine to give to anybody if you are suspecting overdose.
Does anybody else have any more questions for Dr. Parent while we're still here?
I think you should ask Ricky a random question, see if he was paying attention.
I was just watching him. It's so
Hey,
funny.
Ricky, what color is your sweatshirt?
What happened?
We were just giving you a hard time, Ricky. That's all.
You're
Was
giving me,
someone- Oh,
We're just giving you a hard time because you were very animated in your conversation.
oh yeah, I'm in the midst of helping,
Oh,
That's
you're
amazing.
working.
always.
All right. Well, if nobody else has any further questions for Dr. Parent, then we can let everybody go. I will be uploading this video to the Paychex account hopefully later this afternoon. If anybody has any further questions, please feel free to reach out to Dr. Parent directly. And I will also be sending out an updated version, again, of our incident report. So that way, if anybody does need access to that, they can store that right on their local drive. Thank you so much, Dr. Parent. We appreciate you as always.
No problem.
Thanks.
Have
Have
a
a good
great day. Have a
weekend.
great day, everybody.
Sorry.
Bye, everyone. Enjoy your weekend.
Yeah, but for our date.